All right, I think we could probably get started. We're at 60 folks in. So Eva and Judy, do you want to kick us off tonight?
Thank you, Rachel. Good evening, everyone, and welcome. And thank you for joining us tonight. My name is Judy Gonzalez Martinez, and I'm the chair of the Fresno Madera Service Center. Our service center serves 36 local chapters, and we are happy to bring this forum to you.
Hi there, I'm Eva Reese, and I am a California Teachers Association board member, and I represent the Fresno Madera Service Center at the CTA level. Our focus tonight is on a science-based approach to safe, stable, in-person instruction during this global public health crisis.
We're going to be hearing tonight from top research experts in their fields of occupational medicine, infectious disease modeling, and ventilation systems in schools.
And we'll learn about a labor management partnership that has put together one of our state's leading models for COVID-19 prevention in schools.
At this time, we'd like to introduce our guest speakers and give you just a brief bio of each of them, beginning with Dr. Bob Harrison. He is a clinical professor of medicine and the associate director of the Occupational and Environmental Medicine Residency Program at the University of California, San Francisco. Dr. Harrison also directs the National Occupational Health Internship Program and has led many work in environmental investigations of disease outbreaks. He served as a technical and scientific consultant to federal OSHA and to the CDC's Workplace Safety Research Program. And he was a member of the California Occupational Safety and Health Standards Board.
We also have Dr. Natasha Martin. She is an infectious disease economic modeler who developed dynamic transmission models to evaluate the impact and cost effectiveness of public health interventions. She is currently an associate professor in the Division of Infectious Disease and Global Public Health at the University of California, San Diego, and holds an honorary senior lecturer position at the University of Bristol. She is also the co-director of the Biostatistics and Modeling Core of the University of California, San Diego Center for AIDS Research.
Also tonight, we have Keisha Borden. Keisha Borden has been an elementary educator in the San Diego Unified School District for over 20 years and currently serves as the elected president of the San Diego Education Association. Keisha is a strong advocate for quality public education and working families in San Diego and across the state, and has worked to develop coalitions with parents and community members to improve the conditions of learning and teaching in our local schools.
We also have with us today Richard Barrera, who was first elected to represent District D on the San Diego Unified School Board in 2008. He has helped lead the district through the most devastating financial cutbacks in the history of California public schools by pulling together a community coalition of students, parents, teachers, classified staff, neighborhood businesses, and civic leaders around a long-term vision of excellence in our public schools. Despite budget cuts over Barrera's time on the board, students in San Diego Unified have achieved record high graduation and college eligibility rates, record low dropout, suspensions, and expulsion rates, and today rank at or near the top of large California districts in reading, math, science, and social science proficiency. Barrera has also led the district's effort in securing $8.4 billion for school facilities with successful voter-approved bond campaigns in 2008, 2012, and 2018. These bond measures providing breakthrough investments in 21st century technology and environmentally sustainable infrastructure. He has led the efforts to honor the work of our educators by increasing salaries, maintaining affordable healthcare, and increasing effective training for the people who work directly with our kids.
And Teresa Pistocchini is a registered professional engineer and the engineering manager at the UC Davis Energy Efficient Institute and Western Cooling Efficiency Center. For over 10 years, she has conducted applied research in heating, ventilation, and air conditioning systems, including studies focused on California school buildings. Teresa co-authored a recent paper on ventilation and energy efficiency verification and repair program for school reopening.
We also have today with us our moderator, Laura Curry from the California Teachers Association. Laura has a master's degree in public health from the University of California, Berkeley. Laura previously worked in the field of occupational health and safety in the healthcare industry, including during the SARS first outbreak. She has worked in health and safety programs at both UC Berkeley and UCLA. And now we turn it over to Laura.
Thanks so much, Ava and Judy. Welcome to everyone for joining this evening. We have a great set of presentations for you tonight. We hope you enjoy it. We're not going to have time for a formal Q&A period, but if you do have questions, put them into the chat so we can compile those. We can make sure we get information back to local areas, and it also helps inform our union's ongoing education efforts during the pandemic. So I want to first start with bringing Dr. Harrison into the conversation and to set a little context of kind of where we're at in this moment. So, you know, Dr. Harrison, we've just had this very intense winter surge. We saw COVID-19 rates skyrocket far beyond the summer surge. Many families, particularly low-income families and communities of color, watched loved ones fall seriously ill, and many people have suffered unimaginable grief as loved ones passed away from COVID-19. And we've just seen such stark health inequities during the entire pandemic and in the surge. But thank goodness, infection rates are beginning to drop, though we know we can't take our eye off the ball yet. And, you know, California and the Central Valley still remains in a high community transmission with widespread levels of risk in the purple tier. We see the new variants emerging. We'll hear a little bit more about that from Dr. Martin in just a bit around what her models show. We do know that the CDC has told us now is the time to really double down on our safety measures to protect our communities and keep everyone healthy and safe. So given all of that, you know, we often hear, and I've heard you talk about a layered defense against the virus in schools. So thinking about all of those layers, what are the layers that school families and educators should be looking for in their school's prevention plan? And I know you have worked with hundreds and hundreds of institutions to design, you know, very high quality safety programs. So in your experience, what's really needed to take a safety plan from being mere words on the paper, but to really be implemented rigorously day in and day out every day? So if you can share a little bit about that, what are the layers we should look for, and how do we make our safety programs kind of real in our schools?
Thank you, first of all, for having me join you all tonight. Laura, as you mentioned, the last year, I think, has felt to many of us as a very overcast day. I have personally had family members who have been infected with COVID. Fortunately, everyone was okay. I've had close friends with COVID. This is really, I think, for the first time for me, a very personal issue. And also, of course, professionally, because this is probably the biggest occupational health issue that I've faced in my career, and I've been doing this for almost 40 years. I think the sun is trying to break through, but there are still clouds on the horizon. The sun is, we have the vaccine, the surge is going down, but the clouds are the variants of concern that face us and the potential surge in the spring. So absolutely, now is not the time to take our foot off the pedal. Those multiple mitigation strategy, all those layers need to remain in place for the next several months as we see what emergence, as the vaccine becomes more widely available, and we hopefully all as a community care for each other and realize that the more of us who take the vaccine, the lower the infection rates will drop. So I work in the hierarchy of controls, and the hierarchy of controls, I have no PowerPoints tonight. I have my hands, and I have something that I haven't shown anybody. I'm going to show you for the very first time in a minute. So the hierarchy of controls looks like this, but I have to turn my fingers upside down. It looks like this, okay? It's an upside down triangle. And at the top is what we call elimination. So at the very top of that is getting rid of a hazard. So how do we get rid of COVID? What's the elimination? It's identifying cases so that there's no infection in schools, and vaccinating so that we can reduce the risk of people becoming infected. Now, the caveat with the vaccine, of course, is that we don't know for sure yet if that prevents infection completely. It prevents severe hospitalization and death, which is great, right? So I know that if I do become infected, the likelihood that I'm going to wind up in the hospital and die is very, very remote. In fact, nobody in the trials that happened to. But I can't guarantee that I'm not going to become infectious and pass it on to somebody else. We don't know that yet. But we have the vaccine and we have a way to test. So that's at the top of this hierarchy of controls. And then we have all the other mitigation, all those other layers. Some like to call it Swiss cheese. I'm a chocolate cake fan because I'm from New York. And my mother used to bring home for special holidays this multi-layered chocolate cake from Ebbingers. So I'm a multi-layered cake fan. So those are all the strategies that we know work to decrease the chance that somebody becomes infectious. So my only other visual, I want to tell you, this has never been seen before. This, okay? I'm going to make it very easy, okay? I've been trying to think, what makes this easy, okay? You have a triangle, all right? You got teachers at the top. I put teachers and staff at the top because I'm talking to you all and you're top in my book anyway. And I got students and I got parents, okay? And everyone's related to each other in this triangle, right? You got parents in the community. Where do kids get infection from? They get it from their parents. They could get it from each other, but they're probably going to likely get it from the house. The kids bring it into the school. The teachers and staff can get infected from kids. Now, it's less likely that kids transmit, particularly in younger grades, but the evidence is very clear that if you do modeling, and I think we're going to hear from fantastic folks later, Dr. Martin is going to talk about her modeling, that there's this intersection of those three parts of the triangle. And if we break the transmission, if we have those strategies to reduce infection in schools, we're going to reduce the risk to teachers. Teachers are going to be safer. If we drive down community rates, so the parents, right, this part of the triangle here, you know, I'm a teacher myself. So, you know, if I was drawing this on the blackboard, I'd have, you know, the parents over here. If we drive down the rates in the parents, because we're driving down community transmission, they're not going to give it to their kids. And the kids are not going to bring it into school, and they're not going to infect the teachers. So it's not that complicated. It's really not very complicated to keep our foot on that pedal and to put all these measures in place that we know work.
And you mentioned the vaccine. So let's talk a little bit about that. You know, the CDC director urged, you know, state and local health officials to follow the recommendations of the Federal Advisory Committee on Immunization Practices. And those recommendations included prioritizing seniors and essential workers, including those who work in the education sector, in what they're calling phase 1B. Which has been right after healthcare workers and long-term care residents. So we've already seen in many California counties that have already started offering the vaccine to school employees. Some have not, but we know they will very shortly. And I know many educators and school families and school districts are really working with our counties to, get stand up vaccination programs. So for everyone listening, it's really important to make sure you really stay tuned in to your county's health department so you get kind of those updates on a regular basis. But Dr. Harrison, share with us a little bit about the science behind these vaccines and some of the safety and efficacy that they offer to our communities and to our schools. And will you be recommending them to your family and friends? And what would you say to a loved one who might be a bit hesitant to take the vaccine?
First of all, I've had a lot of patients who I've talked to about the vaccine, and I really understand the hesitancy about taking the vaccine. And I think there are a couple of reasons why people have felt hesitant. One is that it went from the laboratory to the clinic in record time, in about a year, less than a year. And when something like that happens, I think understandably folks feel like, well, how can this really be working? Why isn't this experimental? The fact is that the messenger RNA technology, which is the Pfizer and the Moderna vaccine, has been under research for over a decade. So the way of manufacturing a little piece of genetic material, covering it with a little fat blob, a tiny little fat blob that gets it into our muscle cell and makes our cell produce these little spike proteins, which tells our immune system that the virus, the next time it sees it, it's going to rev up and protect us, is amazing. And it's based on technology that's been under wraps that's been under development for a really long time. So the efficacy is about 95%, which for vaccines is nothing short, in my mind, of miraculous. The side effects are not bad. It ranges from a day of aching to a couple of days of misery and fever. A good friend, a very close friend of mine, just had the latter, and she called me and I said, look, friend, I know you feel miserable, and it's sort of feeling like COVID, but I said, you're not going to wind up in the hospital because of this. You're going to get over it in 2 days. So take some Tylenol and ibuprofen and hydrate, and you feel better. And she feels better today. So it can be rough, but what's on the other side of that is immunity that's very, very robust. So I recommend it to everybody.
Well, thanks so much. We want to bring now, we're going to pivot a little bit to go to the San Diego story. So I want to thank you, Dr. Harrison, for being with us and being, such an advocate to bring your expertise to the conversation. So I'd like to talk to Keisha Borden, President of the San Diego Education Association, and Richard Barrera, School District Board President. Thanks for being with us. You all and your district have really set up and established one of the best science-based models that I've seen in the entire state. And so we're really glad you're here with us to share your story. So I want to hear a little bit about the approach that you all have used to ensure a safe and stable in-person teaching and learning environment. How did you go about establishing such an effective joint labor management partnership and a working relationship? And we're going to hear a little bit from Dr. Martin. So give us a little preview around how you connected with some of our nation's top health experts at UC San Diego.
Sure, I can start. So first of all, I just want to say I'm pleased to say that our association has been able to work closely with our superintendent, Cindy Martin, board trustee, Richard Barrera, and the rest of the district leadership throughout the pandemic. Frankly, since March, we've been working closely to make sure that the health and safety of our students and educators is the guiding principle in every decision we make. And so over the summer, we were in bargaining. We were looking at what could we do to bring back our students in the fall. And so as we're having those discussions, we were looking at the safety protocols that would be required. And we realized that the classroom teachers on our side and the school administrators on the other side really did not have the expertise necessary to make those types of recommendations and decisions around safety with such a dangerous virus. And so our superintendent had a relationship with the chancellor at UCSD. And so we were able to connect with these 10 medical and public health experts from UCSD and have those important discussions around health and science, health and safety. And so we heard from those experts about the required PPE and hand hygiene and masking and distancing, ventilation, testing and monitoring, that all needed to be part of our plan before students and educators could come back to campuses. And even at that time, vaccines weren't even an option. So that wasn't even part of the plan. And so SDEA, we're relieved to see that the district leadership has taken that advice to heart through all of the pressure from parents and community throughout this entire process. And really, we've both stuck to that advice. We have to stick to the science because everything else is changing, it's political. And so I think we're very lucky to have this relationship.
Yeah.
Richard, what are your thoughts?
Yeah, no, thanks, Laura. And I completely agree with what Keisha's saying. I mean, I think that, look, when we had to shut down our schools, we knew that we were in for something that none of us had ever experienced, and we had really no ability to predict, you know, how this was going to happen. And so if we wanted to, number one, do right by our students, and number two, do right by our employees and our entire community in terms of doing our part to keep our community safe, we were going to need to stick together through this. And, you know, and we know that there's always people who are trying to, you know, draw divisions, whether it's between the district and, you know, our employees, or between, you know, parents and teachers in the district. And, you know, I think what we had built over a long period of time before the pandemic was confidence that we could come together and take on difficult challenges and be successful in moving forward. And so I think we had a track record of being able to work through tough issues together. And so what we knew we had to, you know, rely on was our ability to work in partnership and stay close to each other, you know, throughout this process. And, you know, and needless to say, where we've been over the last year is so beyond what any of us could have ever imagined. You know, we didn't know if this was going to last 3 weeks, you know, or 3 months. And now, you know, it's going on a year. You know, I think of, you know, it's sort of terrifying to think about how little we knew at the beginning of this. You know, had we, for instance, not shut down our schools, that decision itself to shut down in March was something that we made together. Can you imagine what would have happened if we had kept bringing, you know, 100,000, you know, students and 15,000 employees together without wearing masks, without having any, you know, idea of social distancing? It would have really been a disaster for our community. And so our ability to stick together, I think, has been the key. And that has also led to our ability to solve problems together. And I think about where we got to with testing. So testing is something that, you know, we both, I think, instinctively knew made sense. You know, our ability to actually identify who on our campuses has the virus seems like a sensible, you know, thing for us to do. But Laura, as you know, initially we had people at the state level, you know, others saying, "Oh my God, testing's too expensive. You can't do, you know, the amount of testing that you're talking about." And so then, you know, people would make excuses and say, because we can't do it, because it's too big, too expensive, it's not needed. And, you know, what we pushed through is we said, look, we know the testing's needed. You know, when we started, you know, talking to, you know, our UCSD partners like Dr. Martin and Dr. Martin laid out our model, it became so obvious, the testing was needed. And so what we said is, we're just going to do it. We're going to figure it out ourselves. We developed this partnership with UCSD to have a testing program that allows, at an average every 2 weeks, for all of our employees and students to be tested on our campuses by, health professionals, whether or not they're symptomatic. And that, I think, has helped move this conversation about, just because it's hard doesn't mean you don't do it. It means you have to figure it out. And Laura, as you know, we're hearing a lot of that, same type of, conversation when we're talking about vaccines now. We hear people who are saying, well, it's not necessary, to vaccinate employees in the middle of a pandemic. Just send people back in, without vaccinations, even when vaccinations are there and available and on the horizon. And when we hear that, what we really hear is, it's really hard to figure out how to get our educators vaccinated, so let's just not do it. And again, I think our approach is, no, let's work together, let's figure it out. So we've gone together to the county, we've actually gone to the mayor, and we're on the verge of being able to have a, what we think would be a very efficient program starting in the next couple of weeks in San Diego to get all of our educators vaccinated in order to get back to the classroom. And again, I think our principles are, let's stick together. When we identify something that's hard to do, let's not walk away from it. Let's push through it and get there. And with that kind of sense of focusing on the science and focusing on what's right. Then together we can move other people to get on board.
It seems like you all have really embraced the old phrase, where there's a will, there's a way, and have really brought that to life. So we're going to come back to you two, but we're going to hear a little bit from Dr. Martin to go to some of the science that you talked about. For all of our listeners, I would like to, my introduction of Dr. Martin is to share, how lucky we are tonight to have someone with her expertise with us. Last spring, I remember being shell-shocked. We were all paralyzed in this virus, wondering what was going on. And I remember reading a newspaper story, and it talked about this UC San Diego professor who was already piloting a COVID testing program to be able to return to in-person learning. And I remember feeling so grateful in that moment that there were people in this world who were using their expertise, their talent, their skill, their leadership to help us problem solve out of this unknown situation. And that person was Dr. Martin. So here we have her with us today to share the great work she's done on the Return to Learn program at UC San Diego. And always ahead of the curve, Dr. Martin has also begun modeling kind of what we might see with the trajectory of the new variants to really inform our decisions about what we need to do to keep each other safe. So I want to turn it over to you, Dr. Martin. Thank you for being here, and take it away.
Thanks so much, and thanks for that kind introduction. Just before I start a little bit of my presentation to show you some of the modeling work that we've been doing, I just wanted to echo what was just said, what Keisha and Richard were sharing in terms of, we had the same conversations at UC San Diego when we started thinking about this in March. We were thinking, how can we bring our students back on campus in the safest way possible? And one of the first things we thought about was a testing program. And we heard the same thing. It's too expensive. Maybe it would be too hard to do. Is there any benefit to it? Would there be any benefit to it? Show us the data. So we put together some models to try to understand the value of a testing program, both on our campus, and then we've done a bit of work in the elementary schools to really kind of show that value. And that's what I'll show you today, and has really formed a cornerstone of our program. We're trying to learn from what we're doing here on UC San Diego's campus, and we have, a similar sort of Swiss cheese or multi-layer cake approach, or multiple pillars, whatever you want to call it, in terms of thinking about all the interdependent strategies that we need to reduce risk on campus. And I won't go through them, but they're the standard sort of reducing the risk of transmission, detecting infections, in public health intervention to prevent any infections from spreading. And our approach is really that, these pillars are interdependent, but they're also adaptive. So we're continually taking in new data and revising our understanding of the situation and our approach as we go. And that is also relevant to our testing program and our testing approach, which has changed over time. So I'm an infectious disease modeler, and we've developed a suite of different models to try to forecast COVID at a county level, and also try to use modeling to understand the relative benefits of different approaches to reduce the risk of transmission, both in UC San Diego and other school settings. So we've developed these very detailed models that incorporate different types of individual students and faculty and staff, and how they come into contact with each other in our classroom settings and for at UC San Diego in our residential settings. And we've used them to try to understand the impact of housing dedensifications, classroom dedensification strategies, as well as testing. And I'll talk a little bit more about the testing modeling that we've done today. So we developed these suite of models for UC San Diego, and we've adapted them for elementary schools to try to understand what is the benefit of entry and periodic ongoing asymptomatic testing for both staff and students on transmission and outbreak detection. The first question you usually get is, what is the benefit of asymptomatic testing? Why not just do symptomatic testing? And as you all know very well now, but wasn't quite as obvious earlier on, is that many individuals do not know they're carriers because they either haven't yet shown symptoms or they never will show symptoms. And so if we don't have an asymptomatic testing program, then we either may have many infections that are undetected, or we detect them late. And that increases the chance that those infections could spread to somebody else. So we develop a transmission model, a model of infection transmission in a population, or here I'll present work from models that we did looking at school transmission. And we incorporate what we know about the natural history of disease. So as I mentioned, we incorporate this fact that some people are wholly asymptomatic, never develop symptoms, and you would be unlikely to detect their infections without an asymptomatic testing program. We also incorporate symptomatic testing, and the fact that some individuals do develop symptomatic infection. And so what we're here looking at in this model is, what is the additional benefit of asymptomatic testing on identifying infections early, isolating them, and preventing them from transmitting to others. So one of the things we can look at is, well, what proportion of infections over an 80-day campus term in a school be prevented if we provide both testing on entry, so testing students just prior to the start of term, as well as periodic ongoing testing. And so here, this slide shows you the proportion of infections over a whole 80-day term that would be prevented if we provided symptomatic testing only. So you can see that symptomatic testing is good in preventing infections. There are 3 bars here. So the higher, the better, the more infections we've prevented with our testing program. And the 3 different color bars are showing different transmission rates, what we call reproduction numbers. So on average, how many infections does an infected individual transmit to? So a sort of low estimate would be 1.5. Some of our higher estimates are 3. This will depend on local epidemiological conditions, how well risk mitigation efforts are being enacted in a school, how much masking is being adhered to, et cetera. So as we incorporate those prevention interventions, it reduces our reproduction number, and means that more infections are prevented with our testing program, because we're also there are also fewer infections being transmitted, and we're capturing them earlier because of our testing. So more infections are prevented if the transmission rate is low. But as we increase our asymptomatic testing rate, as we provide asymptomatic testing, then it increases the number of infections that we prevent. We prevent more infections as we expand asymptomatic testing, because we're diagnosing people earlier and we're preventing those transmissions. So you can see here, we've shown a range of scenarios in terms of testing everybody every 8 weeks, all the way up to testing everybody every week. So testing everyone every week prevents between, just around 90% of possible infections, but you can still see that you do very well testing every 2 or 3 weeks, preventing between, let's say, 75 and 85% of infections with the 2-week cadence. Now, I mentioned entry testing, and I also mentioned this periodic testing. And what we see is there's actually quite a substantial benefit to entry testing, so that you test at the start of term and make sure that you're not kind of starting the term with a slew of people who are already infected and bringing those infections into the classroom. And so this benefit of entry testing is in blue, and the benefit of periodic testing is in green. So, these are the same scenarios I just showed you. So the more testing you do, the higher the bars, the more infections you prevent. And you get quite a substantial benefit of entry testing if you're not testing as frequently, because you do a one-time testing sweep and make sure that those infections at the start of term are isolated. But you can still see a very substantial benefit of entry testing, even if you're only testing every 2 weeks. There's less benefit if you're testing every week, because if you don't do entry testing, you'll just be testing everyone the next week anyway. But still, we can see this importance of entry testing along most testing cadences. And so really that being a secondarily important in terms of our testing strategy, to think about both entry testing as well as periodic testing. And finally, I did want to mention a little bit about the work we've done recently thinking about the new variants. So one of the particular variants of concern that we know is already transmitting in California is the B1.1.7 variant, which was first identified in the UK. This variant is particularly concerning because it's associated with about 50% higher transmissibility. And there's also evidence that it's associated with higher mortality as well. And where we have seen this variant arise, there has been rapid expansion as that variant, because of its increased transmissibility, as that variant expanded in the population and became dominant, there was a coincident surge of infections that occurred kind of in the December area in the UK, Portugal, and Ireland. So, as we see this variant emerging in California, we're anticipating and concerned about a potential surge as well. So we've put together some mathematical models. Here I'm showing projections for San Diego, but qualitatively they would look similar across California, looking at what the impact of this variant expansion could be. So it's currently estimated that the variant is about 5%, about 5% of circulating variants in San Diego, and a similar number, maybe slightly less in California in general. And what these projections show you are what we could expect the trajectory of the cases to be, and the fraction of those cases that would be our sort of non-B117 variant, which is in the blue, and the B117 variant, which is in this kind of yellowy orangey color. So starting over here on the left, you can see that even if we're in a situation of declining cases like we are now in California, as that variant expands, even if there's no change in behavior, because this variant is more transmissible, it could lead to a reversal of those recent declines that we've seen, and potentially an increase in cases in sort of March, April time. And that is just because this variant is more transmissible, not because there's any change in behavior. Now that could be mitigated slightly if we have a very aggressive vaccination rollout. So that's what I'm showing here in the middle. If we have a fast vaccine rollout, we could sort of prevent some of that surge happening. We will still expect that variant would become the dominant variant, and you can see that in the figure here as it takes over in the orange. But the surge in cases would be mitigated by a very aggressive vaccination. So really showing the importance of an aggressive vaccination program right now in this context of this B1.1 variant expansion. And on the right-hand side here, this shows the danger of relaxing our behavior too early, or potentially opening up too quickly. That even if we have this fast vaccination program, this really robust vaccination program, if behavior changes and if we reopened sectors of our economy too quickly, it could lead to a surge in infections like we saw, in the November period around Thanksgiving, and potentially overwhelm our healthcare systems because of that sort of surge happening on the back of this variant expansion. So I think, you know, what we're trying to show here with this is that the timing is uncertain. This variant will become the dominant variant. We can help mitigate the risk of a surge by trying to get as many people vaccinated as possible and doubling down on our current efforts of what we know works in terms of reducing the level of circulating virus in the community. So masking, social distancing, and staying at home as much as possible. We know what works, we just need to do that better and be mindful that even though the trajectory of cases has been quite good and we've seen declining case counts in the last couple weeks, that could quickly change. And so just keeping that in mind in the coming weeks. And so finally, you know, whether it's Swiss cheese or layer cakes, you know, we know what works. There's concerns about these and other variants on the horizon, but we just need to double down on what we know works in terms of all the prevention strategies in order to make things as safe as possible and reopen campuses. Thank you.
Thanks so much, Dr. Martin. That was so good to be able to see all of that together around, you know, as Dr. Harrison talked about the hierarchy of being able to control hazards, looking at how testing can kind of play a role in that prevention. So thank you. I want to go back to Keisha and Richard because, you know, there's a lot of questions that came into the chat that I think you saw just around the operationalizing of this. Like, so now we understand the science behind it. What did it take to really put this into action? What are you doing at your school sites to make sure students and their families are, you know, enrolled and signed up for the testing, that it's easy, it's available? Talk to us a little bit about how it works in practice.
Yeah, I'll jump in first, Keisha, and then yeah. So the first thing that we knew is testing was not going to be effective if we didn't do it on our campuses. You know, if we were, you know, going to require, especially parents, to take their kids someplace else to get tested, you know, and especially when we're talking about testing at, you know, frequency of, you know, every 2 weeks. It just wouldn't work. You know, what we need to be able to do, and so in the partnership that we set up with UCSD, it's that UCSD health, you know, professionals come onto our campuses and do the testing. And so then what we have to be able to do is, you know, get permission slips, you know, from parents to allow their students to be tested. We have to set up spaces and auditoriums or, you know, large spaces on school campuses to allow it to happen. But the, you know, the goal is, if it's, you know, Central Elementary School, then Monday is your testing day. And, you know, the students are going to be taken, you know, over to the auditorium, and they're going to, you know, take their test and then back to their classrooms. And, you know, so far we've had limited number of students and staff on campus because we've been doing appointment-based learning for our most vulnerable students. But the program, you know, that we're laying out can scale, you know, to the capacity that we actually need as larger numbers of adults and students come onto campus. But yeah, the key, you know, for us was to develop a partnership with UCSD where, you know, health professionals would come onto our campuses and administer the testing.
Thanks. And, you know, you mentioned, both of you kind of touched on kind of staying close to the science and sticking together. You know, there has been a lot of pressure. How have you guys really stuck together to make sure that you kept high safety standards? And what does your partnership look like in practice? Do you meet regularly? How do you stay in touch every step of the way? What does that look like a little bit in operation?
Yeah, I think all of us are getting pressure from certain groups of parents to reopen. And so I think just maintaining that message that we're sticking with science, we're listening to the experts, because so often we're hearing from politicians who are frankly changing their message from time to time. And so we really have to stick with the science and listen to the experts. We've actually recently re-engaged with the UCSD experts because their advice was from last summer, and we know things have changed since then. And so we really want to make the best decisions for our students and our staff. And so we do meet regularly. Since the testing program started, we have a weekly testing meeting. And so we're so appreciative. Laura, you're there. You help us out with news from CTA. We've had Dr. Harrison consulting with us. So we really are listening to medical experts, listening to the science, and sharing the same message to the community. We're involved. Our biggest priority is the health and safety of our students.
Yeah, and just the only thing I'd add to what Keisha just said is, you know, all voices are important and we listen to everybody's voices, but we also understand that people who claim to speak for all parents or to speak for the community are often very out of touch, you know, with the great majority of our parents and families. You know, the district that I represent on our board consists of some of the highest poverty communities, you know, in our city, and they're communities where the virus is spreading, you know, at very dangerous rates, and parents are very concerned. You know, these are parents who work in the service sector, have to go to work, you know, every day, and you know, they're very concerned about the idea of sending their kids, you know, into a situation that is unsafe for the kids, and then the kids potentially can bring, you know, the virus back home. That voice we don't hear a lot, you know, in the folks that are, you know, so eager to push us to reopen. And we do have a parents group that's really been, you know, quite helpful. Parents who, you know, are wanting us to continue to follow, you know, science-based strategies. And they have gotten organized as well. And, you know, and their voice, you know, has been important, you know, in this conversation. And so, again, we're never going to discount, you know, the voice of any parents, but we know that the perspectives of people in a large, diverse district like ours are diverse. And, you know, to just simply, you know, be swayed by one perspective would not be responsible.
Well, thanks so much, Keisha and Richard, for joining us and sharing the efforts of your district with us tonight. So I want to now move to another topic, which is cleaning our indoor air. We have with us tonight Teresa Pistakini from UC Davis. So public health officials have acknowledged that COVID-19 can spread through the air. Our public health departments have urged schools to bring in more outside air, use a MERV 13 rated air filter, and consider using portable HEPA filters. So most of us are not engineers, so it can feel very overwhelming in this topic. But one of the things I've learned from you, Teresa, is that it's pretty straightforward of what we need to do to improve the indoor air quality in our classrooms. So if you could break that down for us and share with us the basics of what we need to be paying attention to and doing to make sure we're really reducing the risk of airborne transmission in our classrooms.
Great, thanks for having me. I'm going to go ahead and share my screen this evening and just show people a couple of resources on the internet. And what I'll go ahead and do is send those to CTA after this meeting so people can look at them later. So this is our website, and we have a list of resources here for schools specifically. There's a 6-minute video here that goes over ventilation. And a list of just a very short list here of recommendations, Laura, that we are going to talk about this evening. So overall, like you said, the most proven methods for reducing airborne transmission are bringing in outdoor air into a classroom to dilute the indoor air. The outdoor air is free of virus, right? And so you can imagine if there's these respiratory aerosol droplets in our space, when we bring in fresh air and exhaust the old air, we dilute. I like to imagine it like little glitter particles floating around. And as we bring in the fresh air, they sort of spread out, right? We dilute them. The other way we can get particles out of the air is with filtering. And so it's together that the ventilation, the outdoor air, and the filter works together to reduce spread of disease. So that's kind of an overview of how this works.
So while you're mentioning the MERV 13 filters that are there on the screen, so, you know, this is a word we've all now learned in this pandemic is around MERV 13 filters. You know, we've heard a number of districts say they won't work in our HVAC system. They don't fit. What's your advice in those situations where they may not fit? And I guess how widespread is that problem within California's school HVAC system?
Okay, so MERV, just to make sure we're all on the same page, it stands for minimum efficiency rating value. And the higher the number, the better. The larger fraction of particles that are removed. So just to give everyone a visual of this, I just have a plot here so we can see what this means. So in terms of removing respiratory aerosols, we're really concerned with particles that are like in this range of 0.1 to 1 microns. And you can see that this plot here, this is the fractional removal efficiency, like basically every time you move the air through the filter, how much of the particles are removed. And so you can see this is the most challenging size to remove. Interestingly, smaller particles are easier to remove because they don't essentially have as much momentum. And so basically, as we increase the MERV rating, you can see the fractional efficiency goes up. And 13 is the magic recommendation because it does a decent job of removing 40% of the particles of the concerning size that go through it. And remember, we're recirculating over and over again. And generally speaking, MERV 13 filters are available that fit into most existing HVAC systems. Although I agree that there's been some pushback on that. I think oftentimes that's a bit of a misunderstanding or a quick rush to judgment without enough investigation. So, you know, basically speaking, in an HVAC system, you have a slot here for your filter. And there are MERV 13 filters widely available that fit 2-inch filter slots that are pretty standard. Occasionally in commercial systems, school systems, you might get a 1-inch slot. That's where you might run into problems. And the concern is that because the filter media is more effective, the concern is that there'll be a greater pressure drop across the filter and that the fan won't work as well to move the air across the filter, which is a legitimate concern, except there are ways to design MERV 13 filters so that they're lower pressure drop. The way that filter manufacturers do that is by actually putting in more filter media, more pleats. So that way there's essentially, like, imagine if you open the filter and you cut it and you just expanded the media. There's like all of this surface area for the air to go through, and that drops the pressure. And so really what districts can do is they can ask for pressure drop data from filter manufacturers, and they can compare and they can buy low pressure drop designs. They cost a little bit more, but we're talking, you know, dollars per classroom. This is like one of the most cost effective ways to achieve the outcome we're looking for.
So speaking of cost-effective ways, you know, we've seen some districts consider bipolar ionization technology and other new technologies, but, you know, we've seen indoor air experts who've really cautioned against some of those products, that they may not offer the same level of protection as some of these traditional methods that you've described, and they may not be as energy efficient or give the same safety and energy for the amount of money. So can you explain a little bit more about some of this emerging technology that we're seeing and what parents and staff and school leaders really should look out for so that they don't inadvertently buy something that's not the safest, most prudent decision?
Yeah, so I think the priority, really what districts need to do is they need to make sure they're getting the outdoor air that's required into the classroom, that They've got MERV 13 filters in their HVAC systems, and that I should mention are running these fans all the time when the classroom is occupied. So this is not rocket science, but it is a lot of brute force effort to get this done for all the classrooms in California, because generally speaking, research shows that classrooms generally don't have good filters and generally don't have enough outdoor air. So there's just a lot of work to be done, and generally speaking, this needs to be done. Outdoor air should be measured by a certified testing, adjusting, and balancing contractor and technician. So there's just it's got to be boots on the ground, get it done. So then you have this issue where there are manufacturers and distributors offering a better way, an easier way, potentially they would claim cheaper way. But the problem is that many of these things are unproven. And I think given the situation we're in, we have to stick with what we know, what are the greatest chance of success, what all the data and evidence point to will work. One of the sort of primary authorities on how we're approaching this pandemic from an HVAC point of view is ASHRAE, which is a member organization of HVAC engineers, manufacturers, et cetera. They recently released, I have it here, essentially a document on air cleaning, where they specifically say technologies such as ionizers, UV, PCO, and other things, right, are, not only may they not be effective, but they may actually produce harmful contaminants like ozone. And so these technologies are designated by the CDC as emerging technologies without a body of evidence reflecting their, effectiveness. So really, as far as air cleaning goes, school districts should be focusing on mechanical filtration. That means moving air through a filter. That ideally would be in a central HVAC system. It can also be, there are portable air cleaners that can also can help, but those should be essentially filter-based portable air cleaners. Of the various things that are being sold right now, other than mechanical air cleaning, there is some merit to using UVC for disinfection of air, but generally speaking, the way it's being sold and deployed in classrooms is not necessarily how it's been demonstrated to be effective, like in hospital settings. So putting a UVC lamp in a portable air cleaner is not something I'd recommend. I think the funds should be spent focused on, outdoor air and mechanical filtration.
Okay. Thanks. And so that's helpful. And I hope, folks who are listening tonight, if your district is considering these technologies, to ask the hard questions and make sure that data is really reviewed within your school community so that, prudent decision making is being made to keep everyone safe. So, two kind of final things, Teresa, is, you've done a lot of research in California schools, even pre-pandemic, on ventilation. And your research has noted the importance of installing CO2 sensors in classrooms. Can you tell us a little bit about how they work and why that is helpful for maintaining good ventilation rates?
Mm-hmm. So CO2 sensors, we've got a little graphic of one right here. Basically, when you put a bunch of people in a classroom, they're exhaling CO2. And so you can imagine it's building up in the classroom. If outdoor air is coming in, which has background CO2 in it, right? We have CO2 in our air everywhere outdoors. It's not harmful. If you're bringing in outdoor air, your indoor level will reach a steady state of around 1,000 parts per million or less. And if your ventilation system is working as designed. And so that's a way, I've just really been advocating in order to increase transparency for teachers to have a CO2 sensor on the wall with a display. And that's your, daily ability to check if the ventilation system is working. And one of the issues is that we can't tell when we're in a poorly ventilated space, generally speaking. We're poor, sort of, we can sense temperature, we can sense we're hot and cold, but we can't necessarily reliably sense that we aren't getting as much outdoor air as we would hope for.
And we have some exciting news about a state new grant program that's coming online called the School Reopening Ventilation and Energy Efficiency Verification and Repair Program. That's a really long name for the grant program. So we'll show it to you here on the screen. These are new funds that are going to be soon coming online in California for districts to use. So you want to tell us a little bit about this grant program, Teresa, and what educators should do and how they can find out more information about it?
Yeah, just to clarify, so this program is being managed by the California Energy Commission, so I'm not associated with that, but I have been following what they're doing and communicating with them. But this is I think that they have to have essentially an operational program by, I want to say, April. And the way that the legislation was written is that expenses that are in line with the program that occurred prior to the program being operational, I think back to August 1st, could potentially be reimbursable. So this is definitely something, if the school district is doing the steps that are recommended in this program, which are basically, there's some nuances, right? But basically they're what I described tonight, then this is definitely something to keep track of. And so you can, I'll send the link to this website, but there's basically, if you subscribe to the listserv, they'll continually send you updates and information on webinars and program guidelines and all of that. And the actual legislation itself is described here too, that has all the program requirements.
Oh, thanks so much. Any final materials you want to show us from the UC Davis website?
No, I'll just encourage everybody to go watch this video. It just gives a great background. And down here we have a list of resources and some publications. One thing we kind of run short on time. I do have a recent white paper here about portable air cleaners if districts are looking to purchase those, some recommendations in terms of considering performance and cost effectiveness.
Great. Well, thanks so much, Teresa, for being with us here today. So, you know, we want to thank all of our presenters. We've covered a lot of layers of cake and Swiss cheese in this last hour. We've talked about regular testing for students and staff, the importance of the vaccine, good ventilation and air filtration, masks, the importance of physical distancing, hand hygiene, and want to also talk, mention around stable cohorts that many of our schools are also using. So we hope today was informative, that everyone is equipped with the knowledge and power of all of these layers of the cake and slices of cheese that are needed to keep our school communities safe. So thank you to our presenters, and I want to turn it over to Eva and Judy to close us out.
Thank you so much, Laura. And thank you, a huge thank you to our panelists tonight. I know a lot of people in the chat were asking if this is being recorded. So yes, this is being recorded. And I put my name in the chat and my email. Anyone out there would like to email me and I will send this to you. We will be sending it to all of our local chapter presidents in the area. So again, thank you. It was wonderful, an amazing, amazing group of intellect, to say the least, and very, very informative. So this winter, we experienced some of the most deadliest days in this pandemic. There is light at the end of the tunnel with the vaccines and improved access to regular COVID-19 testing, but we cannot let our guard down prematurely. While rates are declining, our counties are still experiencing high community transmission. And as you heard from our panelists tonight, new variants have emerged, some of which are more highly transmissible. So it's not time for our schools to cut safety corners. Rather, it's time for elected officials and school leaders to step up and make sure we have comprehensive layers of prevention to protect students, staff, and our school families.
I know that all of us as educators here in the Central Valley look forward to working with the community, the health department, county officials, and our districts to make free regular COVID-19 testing available for students and staff, and to make sure essential workers have convenient access to vaccination opportunities. Together, our communities can make these important investments in public health so we can achieve health equity in all zip codes across our counties, and to support safe, stable, in-person instruction for all of our schools. Our students and their families deserve nothing less. We want to thank everyone for being here tonight. We want everyone to stay safe, healthy, be well, be safe, wear your masks, wash your hands, socially distance. Thank you, everyone.